Good morning, Tom. I'm here with Marty Becker, coined America's veterinarian. He's been on Dr. Oz, Good Morning America, and I'm so excited. He's here with me this morning, and I get to ask him some questions about our pesky little dogs, but we'll get to that. You do not think like the normal vet. You know, you've got some very unconventional ways of dealing with our dogs.
Well, I want to prevent problems when we can, and it's best to catch things in its earliest phase. So we can talk about high-tech stuff like stem cell therapy.
Oh, that's right.
But there's also things that are available at home that can help your dog live an average of 4 years longer.
Oh, wow.
Two simple things.
Okay, tell me about those two things.
Number one, keep your dog at or near its ideal body weight.
Okay.
One out of two of America's pets is overweight or obese.
Which means not too many treats.
So basically, exactly right. Treats only have 10% of what the total caloric intake is.
Okay.
But it basically is more miles on their feet and less food in their bowl.
Right.
So get them panting tired every day. And rather than using a food bowl, this is the biggest tip. So everybody's putting food in a food bowl.
Yeah, I wanted to
out
ask you
here,
about
right?
that. Get away from food bowls.
Don't use a food bowl. Use a food puzzle. Now, this thing is one kind called a Kong Genius, but the kibble goes inside of here.
Right.
And it's going to come out these little slots. So it's like playing a slot machine at the Indian casino.
Right.
So rather than taking 30 seconds to eat, like a dog will wolf its
Oh,
food
yeah, they
down,
wolf it down.
it takes 30 minutes to 90 minutes to eat. So it not only feeds their body, but it feeds their mind as well. So it's an enrichment activity. So that and really cut down on the amount of treats, the high-calorie treats.
I know, that's hard for me because they're always like, oh, you know,
Well, can I
and
tell you
I
what
want
to
to
do,
give
though?
them a treat.
Just give it smaller pieces. Smaller pieces will be unpredictable.
Because they don't care.
Don't pay off
like
every
I don't have
time.
to give them a big milk bone every single
And
time.
the second thing to increase their life expectancy by 15%, so another 2 years, is daily oral care. Now, only 5% of people, this includes veterinarians, Holly, brush their own pet's teeth.
I know, I don't.
So
I
you're
give them
supposed-
greenies.
You're supposed to. Now, that's good, though. So we have a good, better, best. Good is a dental rinse. So you can put something in their water, and all dogs have to drink. That will
Right.
cut down periodontal disease by
Okay.
30%. Better is to take advantage of a dog's natural tendency to chew. So greenies have the veterinary oral health care seal of approval.
Right.
There's dental diets like Hill's Prescription Diet TD or other dental diets that's in
Okay.
Petco here. You can use enzyme impregnated chews, dentist you can buy in the grocery store.
Right.
All of those are really good.
They're good. Okay,
and
so-
then best is to brush your pet's teeth, but you know, my wife who's here, she does that, but most people don't.
I
But
can't see that I
do
would
better.
Yeah, we've got 3 dogs,
Yeah.
and so I can't see myself. It would take me,
Yeah.
you know, half the day. Okay, here's something that I think is funny, and I want to know about. Here we go. The little blue pill. You're telling me to give my neutered male Viagra, and yet even though he's neutered, he's still, you know, mounting my little female. I'm like, what are you doing?
Now,
So-
how could this be, right? Viagra in a neutered male dog. Well, Viagra happens to increase blood supply to several organs.
Okay.
They happen to find out it had a very beneficial side effect for humans, right? But
Right.
it actually increases blood supply through the heart and the lungs. So dogs with pulmonary hypertension, high blood pressure of the vessels of the
Right.
lungs, we actually give them Viagra to relax those vessels so that the dogs don't have signs of heart failure. And we actually use Botox in puppies sometimes.
I read that
Now,
too.
what that is, Shar-Pays, the wrinkle breeds, or other
Right.
little puppies will come in and their lower eyelid will turn in and rub against their eye.
Oh.
So we use it to relax a wrinkle.
Okay.
So it's not a cosmetic thing, but
but it helps their eyes be
yeah.
more
So
comfortable.
relax. If if it's a Shar-Pei and then the fold is so tight it never gets air to it and gets infected, just use it to relax that
Okay.
skin fold.
I wanted to ask you something about, you say from our own medicine cabinets.
Yes.
Because my little Havanese, she sneezes. At least that's what my vet told me she's doing. She's sneezing. And she says, give her children's Benadryl. I was like, what? Liquid Benadryl?
That's true. But can I give you a better tip here?
Yes, please.
The number one reason people take pets to the vet is skin problems
Okay, right.
across the nation. And the number one cause of skin problems in dog is what's called environmental allergies.
Okay.
So do you have any hardwood floors or tile where you use Swiffers?
Yes.
Okay, a Swiffer. You look on a Swiffer and you see that stuff and you think, oh, God, it's gross. So you throw it in the trash can?
Yeah.
A dog is a Swiffer with 4 legs. So if you think of how much you would get if you'd use a Swiffer every day, that keeps accumulating on your dog's coats. And when
Oh,
humans
yeah.
get allergies, sneeze, sniffle, red runny eyes, red runny nose, they lick, they chew, they face rub, they scratch.
Right.
80% of all ear problems are related to environmental allergies. Most of the sneezing is related to environmental allergies. Most of the anal gland problems are related to
Okay, so what do we do about
You
it?
you start bathing them once a week. And so
Once a week, because a lot of times you hear, don't
dries
bathe
their
them.
skin
Yeah,
out.
they don't
Yes.
do it once a month at the most.
I used to say that until a year ago, and I started talking to veterinary dermatologists who realized what you need to do is flush the pollen, the spores, the mold,
Okay,
the
so
dust.
once a week.
And just ask your veterinarian for a recommendation on any kind of shampoo. Some dogs, you don't have a greasy coat, need a cutting shampoo. Others have sensitive skin. And I like this little product because it has these little fingers that gets the
Do those really work?
These really work. And the other good thing about bathing them once a week is the hair that's genetically triggered to fall out that week. Doing this along with a product called a Furminator you're going to cut down the amount of shedding by 90%.
Oh, nice. We're not going to have all the hair around the house.
Yeah, we know
okay,
about Arnold and the Terminator. Well, that's not too good right now, but the Furminator.
The Furminator.
Yeah.
Okay, tell me something about super glue. You say super glue and KY jelly is something we should have in there.
You probably
first.
think this is
This is
Riball,
crazy.
you know, Viagra, KY.
Like, what am I going to do with this?
What happens, you get a wound in your pet before you get it to the veterinarian, use a little KY, and that way you don't get any dirt or any excess hair in the wound.
Oh, so immediately
And
put this
also,
on the wound,
if you're
okay.
out sometimes and they cut their pad, it bleeds like crazy, just use a little super glue to close the wound before you go to the veterinarian.
That's crazy.
And this is something I really like you to use is, you know, you'd asked me earlier about Benadryl. There's Benadryl your veterinarian may ask you to use in case there's an allergic reaction.
Yes.
But fish oil, if you're taking 1,000, 1,200, 15 milligrams of fish oil a day, use one of those capsules per 50 pounds of body weight. And if the dog's a little bit smaller, just take a little thumbtack or something.
What about the
punch it in.
fish oil foods that they have? Because don't they have
Oh, that's really
food
good
with
as well.
omegas?
Yeah.
Okay,
but
that's...
you can use this with any kind of foods that you feed. And then there's the
like that.
taboo foods. These are the taboo things,
Yeah,
right?
what in the world? Why do we have gum here?
All right,
Am I going to give
if you
gum
look
to my
on
dog?
here, xylitol right there. That's the
that's
terrible
good.
thing. So a
Oh,
lot
that's
of women
bad?
have, that's terrible. A lot of dogs have sugar, or a lot of women have sugar-free gum in their purse. If it has xylitol right there,
Mm-hmm.
a single stick could drop down a 20, 30-pound dog, cause them to go
Oh, my
into
gosh.
hypoglycemia. There's a new study out about aspirin. And at times we used to prescribe really low doses of aspirin for dogs. Now we know that 100% of the time if a dog gets aspirin, it's going to have stomach ulcers. And finally, grapes and raisins. A lot of people give them as a treat. It causes kidney failure, and we don't know why.
Oh my gosh.
So no grapes or raisins for
I
pets.
can tell you, I've never given my dog a raisin.
Good.
It's not something that I would think to do. Okay, I want to tell everybody you can find all of his wacky, wonderful tips in his new book, freshly released, Your Dog, the Owner's Manual. Dr. Marty Becker, tell us how we can get the book.
You can buy it at your local bookstore, I always recommend, Amazon.com, or also on drmartybecker.com. We're doing a $70,000 shelter giveaway, which you can buy the book, but also we're giving away prizes for local shelters.
That's nice. That's wonderful. Well, thank you so much. It's so nice to meet you.
I like
thank
you too. Your wife's close by. Teresa?
I love it.